Something happened to a woman named Dorothy. She was 68 years old, sharp as a tack, never missed a beat. She had spent 40 years as a school teacher, speaking clearly, loudly, and confidently in front of classrooms full of restless kids. But one morning, she called her daughter on the phone, and her daughter said something that stopped Dorothy cold. "Mom, are you okay? You sound different." Dorothy brushed it off. She thought maybe she had a cold coming on. Maybe it was allergies. Maybe she had slept with her mouth open. But here's the thing, the cold never came. The allergies cleared. And her voice, it stayed different, quieter, a little rough around the edges. Sometimes it would crack in the middle of a sentence, like a teenager going through puberty. Sometimes it would just disappear. Like the words were right there, but the voice couldn't carry them. She went on like that for almost 2 years. And in those 2 years, something else was quietly happening inside her body. Something that had nothing to do with her throat. Something most people, and even most doctors, would never have connected to her voice at all. Today, we're going to talk about your voice. Not as a sound, not as a tone, but as a messenger, a warning signal. A quiet alarm system that your body has been sending you, and most people over 65 are completely missing it. There are 7 specific changes in the voice, 7 signs, that are trying to tell you something important about what is happening inside your body right now. And here's what most people don't realize. The voice is one of the most sensitive early warning systems the human body has. It responds to nerve damage. It responds to circulation problems. It responds to hormone shifts, inflammation, nutrient deficiencies, and even changes in the brain. Before those problems show up anywhere else, they can show up in the sound of your voice. So if your voice has changed in the past year or two, even a little, please keep watching, because what you're about to hear could genuinely change how you understand your own health. Let's start with the big misunderstanding. Most people over 65 who notice a change in their voice think one of 2 things. Either they think it's just aging, I'm getting older, my voice is getting older too, that's just life. Or they think it's a throat problem, too much mucus, acid reflux, maybe some dryness. And so they do what feels logical. They drink more water. They take an antacid. They suck on lozenges. They clear their throat 100 times a day. Sound familiar? Here's what most people don't realize. Yes, those things can affect the voice. But when the voice starts changing in specific ways, in ways that feel persistent, that come and go, that shift depending on the time of day or how much you've been active, that's rarely a throat problem at all. The real problem starts somewhere else entirely, and understanding where it starts is the first step to understanding what your body is trying to warn you about. Your voice is produced by 2 tiny folds of tissue inside your larynx, what most people call the voice box. These folds vibrate together hundreds of times per second when you speak. The sound they make is shaped by air from your lungs, movement from tiny muscles, moisture from surrounding tissue, and nerve signals from your brain. Notice something important in that list. 4 different systems: air, muscles, moisture, nerves. If any one of those 4 systems starts to struggle, your voice changes. And after 65, all 4 of those systems are under pressure in ways they simply weren't when you were 40. This changes everything about how we should interpret a changing voice. Let's talk about what's really happening inside the body after 65. First, the muscles. The vocal folds are controlled by some of the smallest, most delicate muscles in the human body. Like all muscles, they depend on regular use, good blood flow, and healthy nerve signals to stay strong. But here's what most people over 65 don't know. The same process that causes muscle loss in your arms and legs, the slow, silent shrinking of muscle tissue that begins in middle age and accelerates after 60 also affects the muscles of your voice box. Scientists call this sarcopenia. Most people just call it feeling weaker. But when it happens in the voice box, the vocal folds can't press together as firmly as they used to. And when they can't press together firmly, the voice becomes breathy, thin, weak. It tires more easily. It sounds older than you feel. This is where the hidden damage begins, in muscles so small you can't feel them wasting in a place you'd never think to look. Second, the nerves. Your vocal folds are controlled by a nerve called the recurrent laryngeal nerve. It's a long, winding nerve that travels all the way down from your brainstem, loops around your chest, and comes back up to your voice box. It is one of the longest nerves in the upper body, and after 65, nerves slow down. Nerve signals become less crisp. The communication between your brain and your voice box becomes a little like a phone call with bad signal. The message gets through, but it's slightly delayed, slightly distorted. This can cause the voice to crack unexpectedly, to hesitate before sound comes out, to sound slightly different in the morning versus the afternoon, to become unsteady, what doctors call tremulous, when you're tired or stressed. What happens next surprises most people. These nerve changes in the voice are often the earliest sign of broader neurological changes happening elsewhere in the body. Changes that, if caught early, can be addressed, slowed, and managed. Changes that, if missed, continue quietly in the background for years. Third, circulation. The tissues of your larynx need constant blood flow to stay supple, moist, and healthy. After 65, circulation throughout the body becomes less efficient. Small blood vessels that supply delicate tissues can become narrower. Flow slows down. Tissues that depend on that flow start to change. The vocal folds are no exception. When they don't receive enough blood flow and oxygen, they lose elasticity. They stiffen. They vibrate less efficiently. The result is a voice that sounds rough, almost gravelly, like there's something coating the throat even when there's nothing there. And fourth, hormones. This one affects women more dramatically, but it affects men too. Estrogen and testosterone both play a role in keeping the mucous membranes of the larynx healthy and well hydrated. As hormone levels decline after 60, those membranes thin out. The natural lubrication of the voice box decreases. Speaking for extended periods becomes uncomfortable. The voice fatigues faster than it used to. Many women notice this most clearly in the decade following menopause. The voice sounds different, lower sometimes, and less resilient. Many men notice their voice becoming softer, less full, less resonant as testosterone levels gradually drop. Here's what most people don't realize. These four factors, muscles, nerves, circulation, and hormones, don't always act alone. Sometimes they work together, and when they do, the changes in the voice become more significant, more complex, more worth paying attention to. Now let's get into the 7 specific signs. These are the voice changes that go beyond normal aging. These are the ones your body is using to send you a message. Sign number 1. Your voice has become persistently breathy or weak, and it wasn't like this 5 years ago. Everyone's voice changes a little with age. That's normal, but there's a difference between gradual, slow change and a noticeable shift that happens over months. If your voice sounds like air is leaking around the words, like you can't push quite enough power behind your speech, that breathiness could indicate that your vocal folds are no longer closing properly when you speak. In younger people, this is usually temporary. In people over 65, a persistent breathy voice that doesn't improve with rest or hydration can be a signal of vocal fold atrophy, that muscle loss we talked about, but it can also be a sign of a nerve problem. Specifically, it can indicate that one of the vocal folds isn't moving the way it should because the nerve controlling it is being compressed or damaged. What compresses that nerve? Several things. A thyroid that has enlarged, a lymph node that has swollen. In some cases, changes in the chest or upper spine. This is why a persistently weak voice deserves a proper medical evaluation. Not just a throat spray, a real look. Sign number 2. Your voice trembles or shakes, especially when you're holding a note or speaking in a sustained way. A trembling voice is one of the most emotionally difficult symptoms because it can feel embarrassing. People hold back from speaking, they avoid phone calls, they stop participating in conversations. But here's what most people don't realize. Vocal tremor, that shaky, wavering quality, is closely connected to neurological function. It's often one of the earliest signs of changes in the nervous system, including conditions like essential tremor, early Parkinson's disease, or other movement-related disorders. This doesn't mean that a shaky voice automatically means something serious. It doesn't. Many people have mild vocal tremor that never progresses and never becomes more than an annoyance. But in combination with other signs, a slight tremor in the hands, changes in balance, shifts in handwriting, a trembling voice deserves very careful attention. The body is trying to warn you. The question is whether you're listening. Sign number 3. Your voice fatigues quickly. It's strong at the start of a conversation but gets rough or fades within minutes. Vocal fatigue is different from just being tired. It's when your voice seems to hold up for a short time and then deteriorates, becoming scratchy, rough, or simply weaker during the course of normal speaking. In younger people, vocal fatigue usually means overuse. Singers get it, teachers get it, people who talk all day get it, but when vocal fatigue happens after normal amounts of talking, an hour of conversation, a single phone call, that's different. That's a sign that the muscles and tissues of the voice box are struggling to sustain normal function. After 65, this can be related to muscle weakness, poor circulation to the laryngeal tissues, or inadequate moisture and lubrication. It can also be connected to thyroid function. A thyroid that is underactive, a condition called hypothyroidism, affects the voice in ways that closely mimic simple fatigue. The voice becomes rough, thick, and tired, almost as if you've been talking for hours even when you haven't. Hypothyroidism is extremely common after 60, particularly in women, and it is one of the most frequently missed diagnoses in older adults. And one of its quietest, most overlooked symptoms is exactly this: a voice that simply runs out of steam. Sign number 4. You've noticed a new and persistent hoarseness that lasts more than 3 weeks. This one is critical. Please remember this one. Hoarseness that comes with a cold and goes away when the cold goes away. That's expected. Hoarseness that comes on after you've been shouting at a sports event and clears up after a day or two? Completely normal. But hoarseness that settles in and doesn't leave after 3 weeks, that is a medical red flag that should not be ignored. Persistent hoarseness in someone over 60 has a wide range of causes. It can indicate gastroesophageal reflux disease, where stomach acid is silently reaching the larynx during the night without causing noticeable heartburn. It can indicate a nodule or polyp on the vocal fold. It can, in some cases, be a very early sign of laryngeal changes that should be examined directly by an ear, nose, and throat specialist. Here's the hard truth. Many people over 65 dismiss persistent hoarseness for months or even years before they get it properly examined. They wait, they hope it clears up, and sometimes it does, but sometimes it doesn't. And the earlier it's examined, the better the outcome in every possible scenario. If your voice has been hoarse for more than 3 weeks, please make an appointment. Sign number 5. Your voice has dropped noticeably in pitch, especially if you're a woman. This one catches many women completely off guard. After menopause, as estrogen levels decline, the tissues of the larynx change. The vocal folds themselves can thicken slightly. The mucous membranes thin out. The result, for many women, is a voice that drops in pitch, sometimes just a little, sometimes noticeably. Many women accept this as simply getting older. And while hormonal changes do affect pitch, a significant or rapid drop in vocal pitch after 60 can also signal other things worth examining. It can indicate thyroid disease, particularly hypothyroidism, which causes the vocal folds to swell and vibrate more slowly, dropping the pitch. It can be connected to changes in testosterone to estrogen ratios that affect far more than just the voice, and it can, in some cases, signal acromegaly or other hormonal conditions that are far easier to manage when caught early. A subtle, slow pitch change over many years is less concerning than a noticeable drop over several months. Pay attention to when the change started and how quickly it happened. Sign number 6. You have to clear your throat constantly, multiple times per hour, and it never really helps. This one is so common that most people completely ignore it. It's become background noise in their lives. But chronic, compulsive throat clearing is a significant symptom that deserves real attention. The real problem starts when people assume throat clearing means there's mucus, so they reach for antihistamines, decongestants, or nasal sprays, and nothing works. Here's why. In many older adults, constant throat clearing isn't about mucus at all. It's about acid, silent acid reflux, technically called laryngopharyngeal reflux, or LPR, is when stomach acid creeps up the esophagus all the way to the back of the throat. Unlike regular acid reflux, silent reflux often has no heartburn at all. You may never feel it in your chest, but you feel it in your throat, as constant irritation, the sensation of something stuck, a cough that won't quit, and the endless compulsion to clear your throat. And here's the hidden danger of silent reflux. Over time, repeated acid exposure to the larynx changes the tissues. It creates chronic inflammation. It can alter the sound of the voice, make it rougher and more fragile, and in some cases, lead to more serious tissue changes over years. After 65, the valve that separates the stomach from the esophagus, the lower esophageal sphincter, becomes less efficient. Sleeping flat can worsen reflux. Certain common medications can worsen it too. And the result is that silent reflux is extraordinarily common in people over 60 and extraordinarily underdiagnosed. What happens next surprises most people. Once silent reflux is properly identified and treated, the throat clearing often disappears almost completely within weeks. Sign number 7. People frequently ask you to repeat yourself or tell you that you seem quieter than usual, even in normal conversation. This last sign is perhaps the most socially impactful, and it's the one most likely to be dismissed as just getting older. But a voice that has gradually become too quiet for normal conversation, that people consistently struggle to hear, can reflect several important underlying issues. It can reflect vocal fold weakness, as we discussed. But it can also reflect something far more significant, a reduction in respiratory support. Your voice depends on breath, on the power and volume of air coming from your lungs. If your breathing has become shallower with age, if your lung capacity has reduced, if the muscles of your diaphragm and chest wall have weakened, your voice simply can't project the way it used to. In some people, this is the earliest sign of undiagnosed lung disease. In others, it's connected to posture. The forward-leaning, rounded shoulder posture that becomes common in older adults compresses the chest cavity and literally reduces the space the lungs have to expand. And in some people, and this is where it becomes genuinely important, a suddenly quieter voice in someone over 65 can be an early neurological sign. Specifically, hypophonia, a medically soft voice, is one of the early signs that neurologists look for when evaluating for Parkinson's disease and related conditions. Again, a quiet voice alone does not mean anything serious, But combined with other signs, a slight shuffle in the gait, smaller handwriting, a reduced facial expression, it becomes something worth taking seriously and discussing with a doctor. Now let me tell you about Margaret. Margaret was 72. She was a retired pharmacist from Ohio, a woman who had spent decades telling patients the right information, asking them the right questions, catching the details that others missed. She was sharp, attentive, and not the kind of person who ignored her health, but she had spent almost 3 years ignoring her voice. It started with what she described as just roughness, a little gravel in the sound. She thought it was the dry Ohio winters. She bought a humidifier. It helped a little. Then came the fatigue. After about 20 minutes on the phone, her voice would start to give out. She started telling family she wasn't a phone person anymore, laughing it off. Then, at a family dinner, her granddaughter, 8 years old, completely unfiltered, said, "Grammy, why do you always sound like you need to cough?" Margaret went to her doctor the following week. What they found wasn't one problem. It was 3 overlapping issues working together. She had developed significant silent acid reflux, which had been chronically irritating her larynx for years. She also had hypothyroidism that had been gradually worsening, going unnoticed because her other symptoms, fatigue, weight gain, feeling cold, she had attributed entirely to aging, and her vocal folds showed the muscle thinning consistent with what happens in many older adults who have reduced their speaking and social activity. 3 months after addressing all 3 issues, treating the reflux, getting her thyroid levels right, and doing targeted vocal exercises, Margaret said her voice sounded like it had 10 years ago. She said the most surprising thing wasn't how different her voice sounded, it was how different she felt overall. Because when the hidden causes were finally found, the solution didn't just fix her voice. It fixed pieces of her health she hadn't even realized were broken. Your body is trying to warn you. Sometimes the warning comes in a sound you've been hearing every day without really listening. Here's a simple self-check you can do right now. Find a quiet room, take a comfortable breath, and then sustain a single note. Say, "Ah," for as long as you comfortably can. A healthy adult over 60 should be able to sustain that sound for at least 10 to 12 seconds on a single breath. If you can't reach 10 seconds, if the sound breaks up, wavers, cuts out, or simply runs out of air before 10 seconds, that tells you something important about your respiratory support and vocal fold function. Also notice the quality of that sound. Is it smooth and steady, or is there a tremor in it, a wavering, like a slightly shaky note? Is it clear or does it sound breathy, like air is leaking through? This isn't a diagnostic test. It's not a replacement for medical evaluation, but it gives you a real-time glimpse into the basic function of your voice and breathing system. And if the results concern you, they're worth bringing up with your doctor. Also pay attention over the next week to these specific moments. First, how does your voice sound in the morning compared to the afternoon? A voice that is consistently worse in the morning can suggest acid reflux during sleep. A voice that gets worse as the day progresses suggests muscle fatigue. Second, does clearing your throat actually help, or does the urge return immediately? If it returns immediately, that's not mucus. It's likely irritation from reflux or nerve sensitivity. Third, do people often ask you to repeat yourself, even in quiet environments? That's worth noting. Keep a simple note on your phone for a few days. Voice in the morning, voice at night. How many times you cleared your throat, whether anything made it better or worse. That information will be genuinely valuable to any doctor or specialist you see. Now let's talk about what you can actually do. The good news is that the voice is one of the most responsive systems in the body to the right kind of support. Many people see meaningful improvement within weeks of addressing the underlying causes. Here is a practical daily protocol that addresses the most common contributors to voice changes after 65. Start with hydration and be specific about it. The vocal folds are covered in a thin layer of mucus that needs to stay moist to vibrate smoothly. Drinking 8 to 10 glasses of water daily is a baseline, but what matters as much as the total amount is how consistently you drink throughout the day. Sipping slowly and consistently keeps the tissues of the throat better hydrated than drinking large amounts at once. Avoid caffeine and alcohol in excessive amounts. Both are diuretics and both dry out the mucous membranes of the throat. This doesn't mean giving them up entirely. It means being conscious that after each cup of coffee or glass of wine, your vocal tissues are slightly drier and compensating with water. Next, manage nighttime acid reflux, even if you don't think you have it. Try elevating the head of your bed by 4 to 6 inches, not just stacking pillows, but actually raising the bed frame at the head so that gravity keeps stomach acid where it belongs throughout the night. Avoid eating within 3 hours of going to sleep. Avoid lying down flat immediately after meals. These changes alone produce noticeable improvement in people with silent reflux within 2 to 4 weeks. For the muscle weakness in the voice box, there is one remarkably simple and effective practice. Use your voice every day, purposefully, not just in passing. Sing along to music, read out loud for 10 to 15 minutes. Have extended phone conversations rather than texting. The vocal folds, like all muscles, respond to regular use. They strengthen with consistent, gentle exercise and weaken with inactivity. This is why retired teachers and retired singers often have better voices in their 70s than people who stopped speaking in extended social contexts. Breathing practice matters more than most people realize. Diaphragmatic breathing, breathing deep into the belly rather than shallow breaths into the chest, is the foundation of vocal power. Lying flat on your back, placing one hand on your chest and one on your belly, and practicing breathing so that only the belly hand rises takes 5 minutes a day and directly strengthens the respiratory support your voice depends on. Posture is connected to voice in ways that are profound and almost entirely ignored. The forward head posture that many older adults develop, where the head sits 2 to 3 inches in front of the shoulders, directly compresses the larynx, limits the expansion of the lungs, and changes the shape and tension of the throat. Simple daily exercises. Chin tucks, shoulder rolls, chest openers against a door frame, done 5 minutes a day, have measurable effects on voice quality over weeks. Check your thyroid. If you haven't had a thyroid panel done in the past year and you're over 60, ask your doctor for one. Hypothyroidism is so common and so frequently missed after 60 that it's one of the first things to rule out when voice changes appear. It is completely treatable, and for many people, treating it feels, as they often say, like waking up. If you take medications, and after 65, most people take several. Review with your doctor or pharmacist whether any of them are known to cause vocal changes or dry the throat. ACE inhibitors, commonly prescribed for blood pressure, cause a persistent dry cough in a significant percentage of people that directly irritates the larynx. Antihistamines, diuretics, certain antidepressants, and even some common inhalers can dry out vocal tissue. This doesn't mean stopping medications. It means having an informed conversation about the side effects you're experiencing. Now let's talk about the timeline, because knowing what to expect helps you stay on track rather than giving up too soon. In the first 1 to 2 weeks of making these changes, most people notice the most dramatic improvement in the symptoms connected to acid reflux. The constant throat clearing often reduces significantly. The rawness and irritation at the back of the throat settles. The voice may feel a little less effortful. Sleep often improves when reflux is better managed. Between 2 and 6 weeks, the changes connected to hydration and vocal use begin to show. The voice has more endurance. It doesn't fade as quickly during conversation. The quality, the smoothness and clarity begins to return. If hypothyroidism has been identified and treated, this is also the window when energy levels begin to recover, which itself improves vocal strength and breath support. Between 6 weeks and 3 months, more significant structural changes begin to appear. Posture improvements start to open up the chest and change the resonance of the voice. Consistent vocal exercises and diaphragmatic breathing begin to rebuild the muscle strength and coordination that has been lost. Many people report that others comment on the change without being prompted, that their voice sounds stronger, clearer, more like it used to. And at 3 to 6 months, for people who have addressed the underlying causes, reflux, thyroid, posture, muscle conditioning, and hydration, the cumulative effect can be genuinely striking. Not a miraculous transformation, not a return to 40, but a meaningful, sustained recovery of vocal strength and resilience that most people never thought was possible. Your body is trying to warn you, but it's also trying to heal. And when you give it the right conditions, the response can genuinely surprise you. Now for the important part. Not everything we discussed today is something you should handle alone. There are specific situations where the voice changes we've talked about require prompt medical evaluation, and we need to be clear about that. If you have hoarseness that has persisted for more than 3 weeks without a clear cause, please see a doctor. An ear, nose, and throat specialist, an ENT or otolaryngologist, can look directly at your vocal folds with a simple procedure in the office and tell you in minutes what's actually happening. This one visit can either give you enormous peace of mind or catch something early that is far better caught early. If you have a vocal tremor that is new, that is getting progressively worse, or that is accompanied by tremor in your hands, changes in your gait, or changes in your handwriting, please speak to your primary care doctor about a neurological evaluation. Early assessment gives you the most options and the most time. If your voice has changed suddenly and dramatically over days rather than weeks, that deserves urgent medical attention. Sudden voice changes can indicate acute problems that need immediate evaluation, not a waiting and watching approach. And if you notice any pain in the throat or neck associated with the voice change, difficulty swallowing, a lump you can feel in the neck, or unexplained weight loss alongside voice changes, please do not wait. These combinations require a doctor's attention right away. Nothing in this video is a diagnosis. Everything here is education. Information to help you pay closer attention to signals your body is already sending you, and to have more informed conversations with the healthcare providers who can properly evaluate you. What we've shared here is what most doctors simply don't have time to explain in a 15-minute appointment. This is the context, the background, the understanding that helps you walk into that appointment and ask the right questions. Let's come back to Dorothy. After 2 years of dismissing her voice changes, she finally made an appointment with an ENT. What they found was a combination of acid reflux that had been chronically irritating her larynx and a mild but noticeable asymmetry in how her vocal folds were moving, one side slightly weaker than the other, consistent with a sluggish nerve signal on that side. Her internist checked her thyroid. It was underactive, not dramatically, but meaningfully. Over the following 6 months, Dorothy treated the reflux, adjusted her thyroid medication, started doing vocal exercises and daily singing, something she had always loved but given up as silly in retirement, and paid attention to her posture and hydration. The last time her daughter called, Dorothy answered the phone, and her daughter said, without thinking, without expecting it, "Mom, you sound like yourself again." That's what this is about. Not chasing the impossible, not turning back the clock entirely, but listening. Paying attention to what your body has been quietly, persistently, patiently trying to tell you. Your voice carries your story. It carries everything you've lived, everyone you've spoken to, every conversation that mattered. After 65, it may be carrying something else too, a message about your health that is worth hearing. 7 signs. 1 clear message. Your body is talking to you. The only question is whether you're ready to listen. If something in this video resonated with you, if you recognized your own voice in any of these descriptions, share this with someone you care about. Because these signs don't just affect you. They often affect the people around you long before they affect your comfort or your health, and the people who love you may be the first ones to notice. Take care of your voice, and your voice will take care of you.